Good afternoon, everyone. My name is Dr. Moser Teles, and I want to welcome you to this presentation from Vanguard Psychiatry and Wellness. Thank you for taking the time to join us today. The goal of this presentation is simple: to introduce our clinic, explain what psychiatric care is, and answer common questions, and helping prospective patients understand what to expect when seeking mental health treatment. Mental health care can feel intimidating for many people. Some individuals are nervous about making the first appointment. Others might wonder whether their symptoms are serious enough to ask for help. Some people worry that seeing a psychiatric provider automatically means they will be placed on medication. Not really. And today I want to clarify those concerns and explain the psychiatric care in a simple, respectful, and practical way. All right? So let's go. Vanguard Psychiatric and Wellness is a psychiatric clinic located in Providence, Rhode Island, right downtown, next to the train station, next to the town halls. All right. Our focus is psychiatric evaluation, medication management, and, when appropriate, supportive psychotherapy and patient-centered mental health care. We work with individuals who are seeking help for concerns such as depression, anxiety, ADHD symptoms, mood changes, sleep problems, stress, difficult concentrating, irritability, trauma-related symptoms, and other mental health concerns. Before we begin the Q&A portion, I want to emphasize that this presentation is for general education purposes only. It's not a substitute for a personal medical evaluation, diagnostic, or treatment plan. Every patient is different. A treatment recommendation should be based on a complete psychiatric assessment, medical history, current symptoms, past treatment response, safety assessments, and individual goals. That's what we do there. Since I'm a psychiatric nurse practitioner, I am holistic by nature, and we evaluate the whole patient on a total thing. Okay, we examine the whole thing, the whole patient, the whole history of the patient. All right. Now, let us begin with common questions. The first question is, what day is Vanguard Psychiatric and Wellness open? Well, at this time, Vanguard Psychiatric and Wellness is available for appointments on Mondays and Tuesdays, mostly the days of the week, but we do see patients the rest of the day of the week. Please give us a call for that, okay? These are current clinic days. However, availability may change over time as clinic grows and as patient needs change. For that reason, anyone interested in service should contact the clinic directly to confirm the most current schedule. I will give the information soon enough. The second question is, what are the clinic hours? Well, the clinic hours are normal clinic hours, 8 a.m. to 6 p.m. Okay. Right now, Monday and Tuesday. I'm going to try to open more days of the week, but so far I do not have patients enough to open the other days, okay? Only schedule days. These hours are designated to provide availability for patients who might need appointments before or after regular work or school obligations. However, appointments times are based on availability, so it is always best to call the clinic or visit the website www.vpw.clinic. It's not .com, it's .clinic, and our phone number at 401-447-4241. Now that we have answered the basic questions about the clinic and the days that we work, I want to move on to the psychiatric portion of the presentation. Third question, what is psychiatry? Well, psychiatry is a medical specialty focused on mental health. Psychiatric providers evaluate symptoms, diagnose mental health conditions, and develop treatment plans to improve emotional, behavior, and functional well-being. Psychiatric care might include a full psychiatric evaluation, that's what we do. In there, a supportive psychotherapy, a patient education, safety planning, and coordination with other healthcare providers. Usually, some licensed mental health clinician, such as a social worker. The goal is not to simply to label a person with a diagnosis. That is too easy and sometimes complicated at the same time. The goal is to understand the whole person, including symptoms, medical history, family history, stressors, trauma history, sleep, substance use, relationship, work, school, and overall functioning. A psychiatric evaluation usually asks several important questions. What symptoms you are experiencing, how long you've been with these symptoms, how much they affect in your life. Have you received treatment before for psychiatric care? Have you tried medications in the past? Are there any medical issues that could be contributing to the symptoms? Are there safety concerns, such as thoughts of self-harm or harm others? Are there social or environmental stresses that might need attention? This is why a psychiatric visit is more than a quick conversation. A good evaluation should be careful, respectful, and clinically true. The fourth question that I'm going to ask over here is, when should you consider seeing a psychiatric provider? A person may consider seeing a psychiatric provider when the emotional, cognitive, or behavior symptoms start interfering with daily life. This may include difficult functioning at work, at school, home, or in relationships. For example, someone may seek help for depression if they have persistent sadness, low motivation, poor sleep, low energy, guilt, hopelessness, appetite changes, or loss of interest in things they used to enjoy. Depression is not a simple being lazy or having a bad attitude. It can be serious health conditions that affect mood, body, thoughts, and functioning. Someone may seek help for anxiety if they experience excessive worry, panic attacks, restlessness, racing thoughts, muscle tension, avoidance, sleep problems, or difficult relaxing. Anxiety can become very impairing when it affects decision making, relationships, work performance, or quality of life. Another example, a person with ADHD symptoms, if they're seeking help, if they have persistent problems with attention, forgetfulness, time management, or difficult completing tasks. However, ADHD evaluation must be careful because many other conditions can look like ADHD, including anxiety, depression, trauma, poor sleep, substance use, now that marijuana and some other medications and substances are readily available, and medical problems such as COPD. Other reasons to seek psychiatric care include mood instability, irritability, trauma symptoms, grief, insomnia, poor concentration, medication concerns, or need for second opinion regarding previous psychiatric treatments. The important point is this: you do not need to wait until life is falling apart to ask for help. Early evaluation can prevent symptoms from becoming worse and help patients understand what is happening before problems become more severe. I want everybody to take a little pause and think about that, right? Seek help before anything gets way too complicated to seek help. In such occasions, we might have to refer you to an inpatient treatment, right? Hardly in my clinic I refer anybody to inpatient treatment, but it might come to a time that we have to for their own safety, right? Fifth question: does seeing a psychiatric provider mean I have to take medications? Nah, not really. Seeing a psychiatric provider does not automatically mean that medication will be prescribed to you. The first step is evaluation. After evaluation, the provider and the patient can discuss treatment options. And that's what we bring in our clinic. All right. We talk to you and ask you, exactly you, okay, to participate in your own treatment. We ask you what is best for you because you know yourself better than anyone. All right. I want to know from you, do you want this treatment? Do you accept this treatment? Do you want something different? Do you want this medication or that medication? What is your concern about this medication? All right. Medication might be appropriate for some patients, but it is not the only treatment option. Depending on the situation, treatment plan may include education, lifestyle changes, therapy, referrals, coping skills, sleep hygiene, stress education, substance use reduction, family support, safety planning, or coordination with a primary care provider. I do a lot of therapies referrals here because there is some therapies that is just outside of my scope of practice, or there is therapists out there that are way better than I am in doing therapy. Psychologists, licensed mental health, clinical social worker, some of them are way better than me and giving these therapeutic ways to cope with what you have right now. Okay. When medication is recommended, the decision should be collaborative between me and you. The patient should understand why the medication is being considered, what symptoms it is intended to treat, how long it might take to work, and common side effects, possible risks, alternative options, and what follows up monitoring is needed. For example, some medications need or could need some drug tests every 3 months. Do you want to take this medication if you know that you're going to have to do this drug test every 3 months, 4 months? Maybe not. Maybe yes, I don't care. I might take that medication. But the patient should feel heard, respected, and involved in the treatment plan. Medication should not be forced to any patient. It should be discussed carefully, and the patient should have the opportunity to ask questions about it. Now, I want to explain what a first psychiatric appointment might look like at the Vanguard Psychiatric and Wellness. All right. During an initial appointment, the provider will usually begin by asking what brought the patient to the care to the facility. What brought you in? This might include concerns such as current symptoms, stressors, goals for treatment. The provider might ask about mental health history, previous diagnosis, medication, therapy, hospitalizations, substance use, medical history, family history, trauma history, and safety concerns. We need to know those informations because these informations make the base for our treatment. All right. If we're going to prescribe any medication or therapy, we need to know the basic informations. Why you're suffering the way you're suffering. Okay. Some patients may complete questionnaires before or during the appointment. I will send these questionnaires to your phone or to a tablet where you can have access to answer these questionnaires. Usually it's a bunch of questions, just yes or no questions. Select all that apply, whatever it is, the questionnaire. I will send to you. You have a tablet there or your cell phone to answer the questions right there and then. Before the appointment or at the appointment, if I think that is necessary, or even after when you are home. All right. Type of questionnaires for anxiety, ADHD, trauma, or substance use. These tools do not replace clinical judgment, but they can help organize information and track symptoms over time. The provider may also ask about sleep, appetite, energy, concentration, mood, irritability, panic symptoms, intrusive thoughts, compulsive behavior, trauma responses, and daily functioning. For children or adolescents, information from parents, guardians, or school records might also be helpful when appropriate and with proper consent. After gathering the information, the provider might discuss possible diagnosis, treatment options, and next steps. Sometimes the first visit leads to medication recommendations. Not that you have to take that medication at that time. Sometimes the provider might request more information before prescribing from parents, family members, schools, prior providers. All right? Sometimes therapy or additional medication evaluation might be recommended first. It is also important to discuss safety. Psychiatric providers commonly ask about suicidal thoughts, self-harm, past attempts, aggressions, access to weapons, or severe crisis symptoms. These questions are not asked to judge the patient, judge you. They are asked to protect the patient and create a safety treatment plan. Now, I want you to speak directly to people who might feel nervous about seeking psychiatric care. Many people delay treatment because they feel ashamed. They may think I should be able to handle myself. Tough. Or other have it worse. Or what will people think if they see me seeking a psychiatric care or provider? These type of thoughts are common, but they can prevent people from receiving care. Mental health symptoms are health concerns. They deserve the same level of attention and respect as a physical health symptoms. If someone had uncontrolled blood pressure, for example, or chest pain, or uncontrolled diabetes, or asthma, what should we do? We should not tell them to ignore it. We should tell them to seek counsel, to seek a doctor. The same way as mental health should be approached, with the same seriousness and compassion. Seeking help is not a weakness. In many cases, it is a sign of insight, courage, and responsibility. I want to review a few psychiatric concerns in a simple way. Depression can affect mood, motivation, sleep, energy, concentration, appetite, self-worth, and hope. Some people with depression cry often, but others might not cry at all. Some appear functional on the outside while suffering internally. Depression might look like fatigue, irritability, isolation, procrastination, poor concentration, or loss of interest. All right? Just 1 second. This is life, Bill. This is life. I have to take some water. My throat starts to itch. Now I want to talk about anxiety. How anxiety shows up on people. How people feel with anxiety. Anxiety can appear a constant worry, fear, panic, avoidance, restlessness, irritability, muscle tension on the neck, on the shoulders, stomach discomfort. I want to go to the bathroom just before a test. Racing thoughts or sleep difficulty, right? Because the thoughts don't stop. Anxiety is not simply overthinking something. It can affect the nervous system, the body, emotions, and behaviors. And now ADHD. ADHD is more than being distracted once in a while. Oh, I was distracted during that meeting that I had or during that class. ADHD involves patterns of inattention, impulsivity, disorganization, and difficulty with executive functioning. However, ADHD should be carefully evaluated because similar symptoms may come from other conditions like anxiety, for example. Right? There's a lot of cross symptoms in there. And other things, manic, for example. Okay? Trauma-related symptoms can include nightmares, flashback, hypervigilance, emotional numbness, avoidance, irritability, exaggerated startle response. Something happens. Why? I don't know, but I have that. Or feeling constantly on edge. Okay? Trauma care requires patience, safety, and trust from us, from the provider, and you, the patient or the client. Right? Sleep problems can be both a symptom and a cause of mental health concerns. That's why sleep is so complicated. Poor sleep can worsen anxiety, can worsen depression, attention, irritability, and emotional regulation. So some of these things that you think it is anxiety or depression, it might be just sleep problems, COPD, okay, or a CPAP, also obstructive sleep apnea that you might not know that you have. Now, let me briefly explain medication management, what it is and how we do over here and why it's so important. Medication management means more than simply writing a prescription to someone. It includes evaluations of the symptoms, reviewing the medical and psychiatric history, choosing an appropriate medication when needed, and starting a reasonable dose, monitoring benefits and side effects, adjusting treatment when necessary, and reassessing progress over time. I have plenty of time to see clients right now, so usually I book them every couple weeks to see them how they are doing their medication in the first months. All right? And once we find a medication that is working, we start seeing less and less frequent. And you continue to take that medication until you may call me again and say, hey, doctor, there is something wrong. The medication is not helping me anymore, or something else happened. I need an appointment again to see you. But clients should know that they are taking and why they are taking and what to monitor for. And we do that. Follow-up appointments are important because psychiatric medications might need adjustment and symptoms can change over time. For some people, medication can significantly improve functioning. For others, therapy, lifestyle intervention, or a combined treatment might be the best approach, therapy and medication. The treatment plan should always be individualized. That means it's made only for you. All right? Almost there, guys. Almost there. Now, let's talk and discuss privacy. Many patients worry about confidentiality. Well, psychiatric care is a private health care. Information discussed in treatment is protected by the healthcare privacy laws, with limited exceptions related to safety, abuse reporting, court orders, or other legal requirements. Patients should feel comfortable asking the clinician about privacy policies, consent forms, telehealth procedures, and communication methods. Actually, in our clinic, we send all this information to you prior to your first appointment. And you always have access to our website, our portal, and then you can see the privacy notices over there. All these notices up to you and is available to you. All right? Now, I want to talk about the telehealth and in-person care. We do telehealth, right? And telehealth can help many patients who have transportation issues, work obligations, school schedule, anxiety about coming to an office, or distance barriers. Although I do have an office in downtown Providence, I know Providence, all right? I know people don't like even to cross the bridge to go on the other side of Providence. That's too much. Driving, oh my God, I'm not going to drive. Hey, I do have a telehealth option, right? Although in-person care can also be helpful, especially when a patient prefers face-to-face interaction or when the provider determines that an in-person visit is clinically appropriate. Sometimes, all right, there is no way. You have to see the patient. You have to see the provider every 3 months or on the first visit. Is law, all right? So we cannot escape. If somebody say that they can offer service for you in Rhode Island completely online, they are lying. They are breaking the law. You have to see the patient. Vanguard Psychiatric and Wellness. The goal is to make psychiatric care accessible while maintaining professional and clinical standards. Now, I want to review the main point from today, everything that we just discussed. First, Vanguard Psychiatry and Wellness is currently available on Mondays and Tuesdays, the whole day, from 8 a.m. to 6 p.m. on scheduled clinic days. Second, psychiatry is a medical specialty focused on mental health evaluation, diagnosis, treatment, and prevention. Third, people may benefit from psychiatric care when symptoms affect daily life, relationships, work, school, sleep, or overall functioning. Fourth, seeing a psychiatric provider does not automatically mean medication will be prescribed. Treatment begins with evaluation and a discussion with the patient, client. Fifth, mental health care should be respectful, individualized, and collaborative. Before we close, I want to encourage anyone who has been struggling to consider reaching out. You do not have to wait until symptoms become overwhelming. If you are experiencing depression, anxiety, ADHD symptoms, mood change, sleep problems, stressors, or difficult functioning, an evaluation might help clarify what is happening and what options are available. Again, my name is Dr. Moser Tellis. Thank you for joining this Q&A from Vanguard Psychiatric and Wellness. For more information, you might visit our website at www.vpw.clinic.